I went and I talked to her and I was like, we did everything we could. We shouldn't, it was hard to see her. She's like, well, he was just alive. He was just alive. And it's so hard to see that. You're just like, oh my gosh. And then, trying to ask, who are these other people that you're with? Who was the guy that was driving him? They're like, oh, we just met him today. And you're just like, oh my gosh, okay. And then you just killed him. That's horrible. I'm really big on mental health for people and figuring out themselves. And it's like, what is burnout and stuff and how people manage that. And one thing I think a lot of people forget is doing your own self-work. You can exercise, you can eat right, you can do all these things. They say, I'll do all these things, but what work are you doing on yourself? So are you listening to podcasts? Are you reading books? Are you going to a therapist?
I had chest pain in my left chest, and it was kind of nagging. It started on a Thursday, and it was kind of deep. And I'm like, what is that? And I'm like, I probably pulled a muscle.
Yeah.
And then the next day it was a little worse. And I'm like, okay, it was pretty constant. I don't think this is hard. And then the next day I was like, oh my gosh, this is really, really bad. And then that night I couldn't go to sleep, and I'm just excruciating. All right, all. Welcome to our latest edition of Nurse Stories. Today I have an awesome guest. I'll introduce her in a second, but first we have to give a shout out to our sponsors, which is 5 Square Aesthetics. 5 Square Aesthetics helps nurses get where they want to be in their own aesthetic business. So nurses, if you are looking to get into aesthetics, Botox, fillers, all that kind of fun stuff, and you want a nice little side hustle, reach out to 5 Square Aesthetics. They will get you where you want to be. It's super cool. Today's guest is Caitlin. Say hi, Caitlin.
Hello.
Caitlin is been graciously come and get on our podcast, and we're doing something different that we've never done before. What are we doing? We're running some IVs. Look at that. She came in. She's like, I'm a little dehydrated. Do you want to do some rehydration? I'm like, yeah, let's go for it. So she got all of us injected, including Nate behind the camera. So
gotta try it out.
Thanks for bringing that out.
Yeah, of course.
And that's part of your business, right?
Yeah. It's part of one of my side hustles, definitely.
One of your side hustles? So what are your side hustles?
I also have been a sexual assault nurse examiner. I kind of tried to back off on that a little bit, but I just can't give it up. It's way too hard to give up. I still pick up in the emergency department, and full time I am a flight nurse.
Wow.
Yeah.
You're busy.
Busy.
But you didn't mention your number one job. Being a mom.
Oh yeah.
Right?
Yep. And I'm a mom of 2 little girls. Yep.
2 little girls. How cute.
Yep.
I have one girl. She is 16. I pity your teenage years. My daughter's great. I love her.
That was my first flash of fear that when I found out I was having girls was, Lord have mercy, the junior high and high school years.
It's awful. And I've got.
I was awful.
Yeah,
I've
got a really good daughter. Girls are easy when they're little.
Yeah. Oh,
they're hard
so
when
cute.
they're older, and it flips with boys. Boys are harder when they're little, but easier when they're older. Boys do stupid stuff when they're older.
Yeah.
But it's fun.
They get away with it more.
Yeah. So, well, that's great. That's a lot on your plate. So kudos to you for doing that. Tell us a little bit about your backstory, like where you came from, how you got into nursing, how you got into these side hustles. I'd love to hear that.
Yeah. So initially I started out just applying to nursing school, and I wasn't really sure if I wanted to do it or not. And so once I decided I wanted to do it, my grades went from mid B's to A straight, because I knew that's what I wanted to do. And then I thought I'd be a medical office nurse, and then I learned what nursing actually was and all the stuff that you had to know. I was like, what? I have to know what the doctors know? I had no idea. And so then once I did my rotation in the emergency department, I was like, this is my people. This is my thing. And so I just did that. I thought I was going to die there pretty much. It was super cool and fun. And I started down in San Diego for a little bit. So we saw all sorts of crazy people, and I love crazy people. They're my favorite. And then I moved up here and worked for about a few years. And then, after COVID, everyone was contemplating life and what they wanted to do next. And I just wanted to keep learning and challenging myself. And so I wanted to push myself, and I thought I would never do flight nursing. And I was like, well, I'm going to do flight nursing, and I'm going to try that. And so then I got into that. Partway through, I kind of got also a little bored, and I started the SANE nursing also too, because I realized I kind of liked the psych patients and the, having empathy for people in those moments of crisis and stuff. And so then I dabbled into that a little bit. And I've loved that. And then my friend decided to start an IV therapy business, and I thought I'd help her out on the side. And turns out I love it too.
Cool.
I love being able to help people. If it keeps them out of the ER and keeps their hospital bills lower, then absolutely. And most of the people I meet are just absolutely the sweetest.
Gotcha. How'd you get
Yeah.
into forensic nursing?
Um, a coworker I knew, she ran she ran one of the programs locally, and she told me about it, and the information just fascinated me. It was just so fascinating. I think it is a very misunderstood area of nursing, or even the world in
How
general.
so?
There's some crazy statistics. That's like one of it is like how many she, I was like, I was one of those people that said, well, how many, are falsely reported? And she goes, well, actually, it's about less than 3%. So
Really?
yeah, it's a very small percentage of people,
It's funny you say that because the media, when there is a false,
mhm.
they cling on to it. It makes it seem more makes it seem more prevalent than it actually is,
Mhm.
right?
Oh, it's super prevalent, and I mean, one of the things too is that, most people 1 in 3 people in, like, all of us, has been sexually assaulted as a child.
Men and women,
Men and women have been
1 in 3.
1 in 3 as a child, which actually contributes to I don't you have you done the adverse childhood experience score? I've
I
heard
have
of
not.
that. So that's another thing too, is, it's, a score or some study that they did down in San Diego at Kaiser or whatever, and, they found that there was a big correlation between, like, the higher people's, adverse childhood experiences, whether it was trauma or sexual abuse or, alcoholic parents. There's a whole score. And the higher your score is, the more likely you are to have comorbidities and what's the word? To have hypertension,
Oh
diabetes,
yeah, yeah, yeah.
what's the I can't think of the
No,
word.
comorbidity. Yeah,
Yeah.
yeah, 100%.
A bigger medical history.
Associated
Yeah,
factors.
yeah. And once kind of learning that, it actually did make me think a lot too. Like, wow, most of the patients that we see are traumatized people. So yeah, so it's changed a lot of my even stepping away from the ER for a little bit too has changed a lot of my perception of patients and, everyone's mental health, even as nurses, I guess too.
Mental health's
So yeah.
huge. Mental health's huge. I mean, like to your point, this trauma. I mean, what if those statistics are correct, 1 in 3 people, that's
Mhm.
not trauma you get rid of very easily.
No.
You hold on to that forever. And
Mhm.
I'll tell my patients sometimes that are like dealing with stressors. And when I say
Mhm.
stressors, like, oh,
Mhm.
let's say divorce or
Mhm.
I just got fired or things of that
Mhm.
nature. Stress is important because it helps us get through things,
Mhm.
but it's detrimental if you hold on to it,
Mhm.
right?
Yeah.
And when you hold on to stress, the cortisol is always high, you're burning through it, and then you have all these negative health outcomes as a result. Well, think about somebody that's traumatic and every day they're thinking about this traumatic experience in their childhood. That's perpetual stress. They're going to be
Mhm.
inflamed, overweight, depression, anxiety,
Mhm.
all of that stuff, and they're going to suffer from it.
Right. Or they never deal with it and they don't know why they react the way they react, because people who have experienced extreme trauma, their amygdala, their smoke
Mm.
detector, you know what I'm talking about,
Mhm, I
right?
do.
Is going off, and so their reactions are so much more reactive, and people don't understand why they react that way.
Yeah.
So, yeah, it's
It's pretty awful. So how much of your week, month are you spent in that branch of medicine, like or the forensic nursing, the sexual assault? Tell us what exactly you do in that line of works.
In that so right now I cut back a lot after having kids. It's really hard to coordinate kids and,
I can imagine.
spend going out and spending time to do these cases, because I want to give them my full attention. Because the biggest thing, and this is kind of helpful with all patients, is if you're ever having a problem with a difficult patient, is listening and giving them your full attention without interrupting. And that's really hard for a lot of us to stop and say, hey, well, get to the point. I understand, you want to give me your whole 15-year history, but, just get to the point. Why are you here? Right. And so I just feel like I couldn't give my patients that attention right now. But pretty much we get called into the ERs, and
So
the
it's an on-call
pretty
basis.
much, yeah.
Okay.
It's an on call. So if something happens, they should present to the ER. They usually will call detective police department, and then they will call us. And then we try to do the interview all together with the detectives and with the victim witness coordinators and the advocates. So it's all told the story all at once because the more they tell their story, the more they're being re-traumatized. So we try to get all the story all at once, and then once we hear what they have to say, typically the detective will leave the room. I'll do a full assessment, get swabs, whatever else needs, pictures, photos, and then that's kind of about it. And it could take a little bit of time depending on
Couple
how.
hours.
Yeah, a little bit more than that probably, depending on how much of their story they wanna tell.
Mm.
Yeah.
And so you don't really. I'd imagine the detectives are trying to probe and get some information out of them a little bit more. You're not doing so much of that. You're just listening.
No, yeah, pretty much listening. Sometimes I'll ask some clarifying questions, but yeah, they don't really probe a whole lot. They are there they've been trained pretty well to listen to. They'll just try to ask more specific questions so that they could, locate the guy
Mhm.
or, identify exactly where it was, just more detailed questions.
Gotcha. Do you find that line of work rewarding?
I do. Definitely I do. There's sometimes where yeah, you feel bad for them, but some life goes on and I kind of forget about, what had happened the week before the story that I listened to because you hear sometimes similar stories over and over again. It's hard to remember which ones are like the most significant to really harp on it,
So
I
how
guess.
do you let go of that? Because you're taking on their story,
Uh-huh.
and I'm sure you're empathizing with them, like
Mhm.
you're putting yourself in their situation.
Mhm.
How do you let it go?
Um, sometimes it depends on how bad it is. Sometimes if I can't let it go, that's usually where I reach out to my friend, like Christy.
Mm.
I'll reach out to her and it's like, it's a girls' wine night. We're gonna talk, we're gonna bitch about our patients and all the crazy stuff that we see and then kind of let it go. Luckily my husband is not in healthcare, which is actually kind of nice because I can let stuff go instead of like getting into all the details. And if all the details are too much, it's like not even worth telling the story
Yeah,
or him understanding.
husbands are good at
And
that.
so yeah, and so it's really good, and so that's why also just finding that friend that gives you that validation too, and like, yeah, what you saw and dealt with is really crazy, and like just getting that validation is huge for me to go, yeah, that was crazy. Okay, like now moving on.
Yeah. Who funds that program? Is it a grant? Is it the county?
Oh, that's a
Do
great
you
question. I
know?
don't, I don't know. I think it was the county was doing it. We were working through like another
Mm.
like another resource center, like a women's, not women's shelter, but kind of like that, a women's family resource center. And they were funding us for a while and they got it through donations and charity and stuff. But now I think our funding is actually changing. And since I kind of stepped back a little bit, I don't fully
Yeah.
understand how it works.
Well,
But
usually,
yeah, that's fun.
this is nurse stories, but I'm not going to make you tell any specific stories in that line of work
Uh-huh.
because there's probably not a lot of happy or funny stories in that line of work. So let's not go down that pathway and bring
Yeah.
up some trauma to you.
Yeah.
Uh, but I know there's a good story or two in
Yeah.
flight nursing and ER.
Okay.
So which one do you want to tackle first, flight
Uh,
nursing or ER?
yeah.
Well, what's your favorite?
Well,
Do you like the ER better or do you like flight nursing? I mean, they're kind of
it's
similar.
just different. I do like flight nursing full time for sure. It's not as much running around on my feet like ER. It's just I didn't realize how much the ER was so exhausting on your body, running around on your feet for 3 or 4 days in a row, however you like to stack your shifts, I guess.
Yeah, you'll walk 7, 8 miles
Yeah.
in one shift
Oh yeah.
easily.
Oh yeah, it's a lot. So no, flight nursing is fun. Got a, I have a lot more autonomy and being able to do what I want to do. It is kind of the same like the ER, like 80% of it is not really that exciting.
Until you get the call.
Even the calls sometimes not really that exciting because we work in such a rural area that, their specialties are so limited. So we do transport stuff.
So are you doing mostly
Minor stuff.
transport? Is that what you mostly do? You're not doing like search and rescue type stuff, are you?
We don't do search and rescue. We'll do search and assist where we can like look for people, but we call them scene calls and we'll go out and pick up people out in the mountains or the wilderness. So like local EMS companies will usually get called out. 911 is dispatched. And if it's something that's above, if they're just a BLS ground crew, and they need ALS, then they will activate us usually immediately, unless they get to the patient and realize that they're fine, then they'll cancel us. But
Gotcha. What's a crazy backcountry story?
oh man. This one's kind of good because this kind of goes along with like trauma and the trauma that we see too. I guess it was about last year. It was we went out on a call. It'd been a busy weekend. I mean, I think it was like what weekend
Like a Memorial
before,
Day or
yeah,
something?
like July, 4th of July or something like that. It was just a crazy weekend. So we were just getting call after call after call. And we get, I think it was like our third or fourth call in a row. And we go out and they're like, oh, yeah, you might need like help lifting the patient out. And we're like, okay, like we can't lift him, we can't hoist him, we don't do anything fancy like that. But we're like, all right, well, we'll just get there and see first. So our pilot makes an awesome landing in between the trees in like this little like circular area that he found. And so we were actually the first on scene besides the sheriffs, but they don't really count because they don't know anything medical. And they're like, we can't really get to the guy. They were down in a ravine. So we decided to go hiking through. And mind you, I was 20 weeks pregnant at
Oh my
the
goodness.
time too. So I was like, it's okay. Like I'm carrying my stuff. I'm trying to go through and I end up falling in the river. And and anyways, we couldn't get to the guy. So we're like, we have to go around. We have to go around the other way. And so we were going around the other way. They some other sheriffs I think got to the guy and they're like, oh, he's here, he's doing okay, I guess. He had some chest wall trauma, his leg was deformed or whatever, and so we were going to get on a UTV and they were going to try to drive us, but it looked super sketchy. Like super sketchy. It was like it was if go one way and you roll down, hence they rolled down. So I had like one leg out the whole time in case it was going to start
Oof.
rolling. Even the sheriff was
Then
like,
we'll need another helicopter, right?
sheriff was like, he goes, if it starts rolling, just leave me be. Like, I'm fine. I lived my life. And I was like, okay, cool. Like,
Oh,
all
that's
right.
sketchy.
I looked at my partner. He's like, let's go. And I was like, okay, let's go. So anyways, and then they paged overhead and they go, patient went unresponsive, starting CPR.
Oh, no.
We're like, oh no, now the pressure is on to get there. And it's like, oh my gosh, we've already wasted 20, 30 minutes trying to get there. And so we get there and they're doing CPR. So my partner and we just instantly go to work on him. And the first thing you do with trauma rest is finger thoracotomy. So cut his chest open on both sides. And then we did CPR for about 30 minutes and no, we could not get him back. And also we were thinking, how the hell are we going to get him back? Or how are we going to get him out of here? Because we had to like just roll down a ravine down. Just and I was like to try to climb out and get him out of here, his legs deformed and whatnot. And so anyways, we were just kind of trying to figure out, what's going on,
Did you
who's
declare
who.
him?
We did. Technically, we're supposed to have medical control do it in the state of Idaho, but we were 30 minutes away from our helicopter and we had no service, whatever. So we had to declare him. And the fiance was right there. And that was hard. That was super hard. Not the whole call,
So
like,
was this a male patient that you
yeah,
were?
yeah. And
So
so,
for those that aren't in the medical field, describe a thoracotomy.
oh man, put me on the spot.
Yeah. Well, I mean, just
Good thing I just did the cadaver lab and got on my.
yeah, just briefly. You don't have to go into anatomy or stuff like that.
Like in chest trauma and stuff, as air starts building up, it starts, or even fluid too, blood too, starts putting compression on or pressure on the heart, and the heart can't pump properly and function. And so we try to, we're trying to relieve that pressure, and because it's either blood loss or
Air.
or blood. So the first thing you do isn't shock the patient, isn't give epi. One of the first things that we're trying to push for is not needle decompression, is to just cut them open and do a finger thoracotomy and cut through the ribs like a chest tube. It's pretty much a chest tube. If anyone has seen a chest tube, it's pretty much a chest tube without putting in the chest tube. That's kind of, I guess,
But
easy way to
anyways,
describe
the
it.
reason I wanted to describe that is because the fiance is watching that.
Yeah.
And,
Oh, yeah.
and that's pretty traumatic.
And when you're under stress like that, I didn't realize it till afterwards. I cut big holes in him too. And I was looking at him, I was like, oh my gosh, I'm so sorry. Like,
Yeah.
I was trying to cover it up. And, I went and I talked to her and I was like, we did everything we could. We shouldn't, it was hard to see her. She's like, well, he was just alive. He was just alive. And it's so hard to see that. You're just like, oh my gosh. And then, trying to ask, who are these other people that you're with? Who was the guy that was driving him? They're like, oh, we just met him today. And you're just like, oh my gosh, okay. And then you just like killed him. I like, that's horrible. That is so,
So the
so
driver, they
horrible.
met the driver, and the driver killed him.
Pretty much. Yeah. I don't know
Did
if
they
they were.
roll an ATV down the hill? Is that what happened?
Yeah, they rolled. They weren't wearing their seatbelts or helmets, and stuff like that. And so that was really hard. To watch that. And then also then we had to carry his body out, and then we were driving out and
Were they
everyone's
making you
following.
lift?
We didn't lift him out.
Oh, you
We
don't
didn't.
lift. You told them.
Right. But we did have to bag his body and then carry it out, and we're like trying to flop it onto the ATV, and that's just awkward. And then everyone's following behind us. You still have to respect the body,
Sure.
even though it's dead. It's kind of
Well,
weird to
there's
just be
laws on
like, I'm
that.
gonna Oh,
Yeah.
really?
Oh yeah,
Oh,
there's
well, good
laws
to
like
know
you have to. Well, I
that.
mean, in your situation, nobody's going to press charges or anything like that. But
Probably.
there's definitely laws, and I'm not keen on that. But there's definitely
Yeah.
laws with dead bodies, like how you have to treat them and respect them and all that kind of stuff.
Yeah.
But I mean, that's an extraneous situation, 100%. But
Yeah.
well, that's crazy. Who's on a flight team? Like,
It is a paramedic, a nurse, and a pilot.
okay,
Pretty much that's it.
who runs the show? The paramedic
The nurse, because they have the higher
license.
license. Sure.
Okay, so
Yep.
you're running the show. You're saying,
Not necessarily. We share equal roles.
okay.
We do. We try to push for that. I mean, they know so much. They are such a wealth. Our medics are such a wealth of knowledge that the nurses don't get to see. They deal with airways so much more than nurses do because we rely so much on our RTs, right?
Mhm.
I work with some super, super smart, awesome medics that some of them, in those moments like that you heavily rely on them to, think outside the box in those situations and stuff like that. And, if we ever have to make any really hard decisions, then yeah, if everyone's looking at you and you go, oh, yeah, that's me.
Is it a paramedic or EMT?
Paramedic.
A paramedic.
Hmm.
I can't remember the ranking. Is EMT higher than paramedic?
Oh, no, no.
Paramedics higher
Don't
than
tell them
EMT.
that.
I can't remember.
No, EMT's like basic. Like they do vital signs.
Okay, gotcha. My
And put on a C collar.
when first of all, they don't get paid enough.
Oh, heck no.
Like it's horrible.
Yeah.
Like what they're paying.
We do the same job and they don't get paid nearly as much. And they probably take way more abuse than nurses do.
Oh,
And
100%.
imagine you see the patients that come into the hospital, they have to go into those people's houses. That's just like, imagine that. Like, it's disgusting. I've been into some of the houses and it's disgusting.
People are disgusting.
I know sometimes the paramedics come in and do crazy things or you think, oh my gosh, why did they do this? Well, there's a reason.
Mhm.
There's a reason that they did or that they did not want to do something.
100%. When I was going through my clinical rotations, as I was becoming a provider, one of the clinics I worked at, it was run by a nurse practitioner. For his for his MAs, he would hire um, uh, paramedics,
Hmm.
and they would come in and do clinic work for him.
Hmm.
And I was like, why are you doing this? Like, oh, we make way more money in the clinic than we do out on the road.
Hmm.
And there's a wealth of knowledge. I mean, they'll come in and say, yeah, this guy's got this.
Hmm.
He's like, oh, okay. And
Yeah.
I'm like, what's going on here? And
Yeah.
I'm like, oh, this is a good business idea. Like, they
Yeah.
want extra money. They come in, they work a day or two a week in the clinic, and
Uh-huh.
like an urgent care type of
Oh,
situation.
okay.
They
Yeah.
could throw an IV in,
Yeah.
they could do all that kind of stuff, and just they're awesome, and they are underappreciated. 100%.
Oh, for sure. They have to make a lot of decisions on their own. Where nurses get so comfortable in having the doctor right there,
Yep.
But they got to make these decisions all on their own, and so pressure's on them. So if they do slip up or make a mistake, you
It's
try
on
being
them.
in their shoes. Yeah.
It's on them. Yeah, I don't know what kind of liability they have. Do they have to carry malpractice insurance? Do you know?
Oh, I have no idea.
Yeah, interesting.
I have no idea, and I don't think many people say anything about it either.
Yeah. Well, so that's like a backcountry thing. Another thing that flight nurses do a lot of, as you mentioned, this is transport.
Yeah.
Uh, this is interesting. I don't know if you know the answer to it, but I kind of know the answer to it. Do you know the cost of a transport?
I don't. There's rumors.
Okay, so I actually
There's rumors
asked.
about how it
I
might be.
actually, so I worked at a hospital for a while,
Uh-huh.
and I actually ask people in the know.
Uh-huh.
So to fly from McCall, Idaho, which is
Okay.
about 2 hours north of Boise,
Yeah.
as you drove to Boise in a fixed wing,
Uh-huh.
and this is years ago, so it's probably gone way up. Guess how much that little 2 hour flight, or not even, it's not 2 hour flight, it's like 45-minute flight. Guess how much that cost?
Probably 25,000.
Nope, it was about 8. A helicopter, however,
Oh, it's way more.
that
Yeah.
now you're in the $28,000 mark.
Yeah.
The helicopter, I was like, holy smoke. So when you respond and you're billing insurance, they're billing tens of thousands of dollars
Mhm.
for those. And because it's so expensive to operate a helicopter.
Mhm.
It's
Mhm.
so expensive to operate a helicopter. So it is not a cheap endeavor. So those local programs you have with, the different flight companies,
Mhm.
it's worth the $50 a year enrollment because they'll cover all your costs.
Oh yeah. Oh yeah. I always tell people now,
I
and I was like,
Buy
yeah.
it for your family. It's $50, $100, whatever it is. You
Yeah.
use it once, you'll pay for it forever.
Yeah. Oh yeah. It's definitely worth it than eating that cost. And especially if something like that happens, I've seen some of the EMS people out there and I'm like, "Oh Lord, please don't ever touch
Right. Right.
Like, I'm like, really hope I don't have a medical emergency, and I hope the weather's good so a helicopter could come here and help me and my children.
So you do that part-time?
Full time.
Oh,
The
it's,
flight,
the
yeah.
flight nurse. Okay,
Mhm.
you do ER part-time.
Part-time, yes, I
Okay.
still pick up there.
Night shift, day shift, swing shift?
Mid-shift, whatever. Luckily in the ER, you can pick up 4 hours, you can pick up 8 hours, you can pick up 12 hours, so it's really nice. I try to stay in the 4 to 8 range to maintain some sanity and home life, but then also get to dabble and run around a little bit still and stay up on some skills. Yeah.
Tell us the nurses, for the layman out there, tell us the nurse role in an emergency room.
Oh,
Like,
there's like 5 different roles.
okay,
What do you
talk to them.
So you have, well, first you have the triage nurse, that kind of you know, that people come in and say, "This is wrong with me," and you pretty much look and say, "Is the patient sick or not sick?"
And
That's your job.
they're staying at the front desk, right?
Yeah, pretty much. Depending on every hospital's triage, I feel like is set up differently. So triage nurse pretty much determines sick or not sick. You got, you know, the nurses that are doing their regular rooms, and usually about 4 patients, depending on the hospital again too.
Yeah.
Usually there's some sort of critical care nurses that usually have about a couple rooms, or you have float nurses that go around and help with the sick patients. We do have a pediatric trauma nurse on shift there, and then you got the charge nurse. What other kind of nurses are there? I think there's always so many
Well,
different
and then you got the
positions.
management nurses.
Yeah.
You know, you rolled your eyes a little bit.
Did I?
A little bit. So I'm like,
I'll have to go
ooh,
back and see.
there's something there. Management nurses, but yeah, the ones you deal with are the patient facing ones, or
Yeah.
the ones that you just
Yeah.
talked about. Gotcha. So which of those roles do you like the best?
In the ER?
Mm-hmm.
I actually love triage.
Triage. Why? Because it's easier.
The autonomy,
Mm.
because we have protocols to determine if like something needs to be done, and you know, I've started stuff and never really been questioned about it by the doctors that I work with. I think they're more appreciative that I got stuff started and ordered labs and got stuff going versus sitting around waiting to be told what to do and push patients through faster and get them seen faster and stuff like that. It's just a little more flexible, I think.
You
And
like the autonomy stuff.
yeah, hence the flight nursing too.
Well, I mean, therapy, right?
Yeah, exactly.
Get into that a little bit. I had a
Yeah.
friend who is a ER nurse down in Utah,
Uh-huh.
and when he applied for the job, they interviewed him. They're like, "Okay, you got somebody coming in for chest pain. What are you going to do?" And he's like, "Well, talk to the doctor." They're like, "No,
Phew.
no, that's not. That's
I
no.
hate those
Like,
kind
what
of
would you do?"
nurses. Yeah.
And he's like, "Well, chest pain, and he couldn't get to it. And then they're like, what would the doctor do? And he's like, oh, they'd order an EKG and get an IV started and do some blood work. And, and he's like, that's what you do. So there's the autonomy you're telling him. Like you got to think, okay, the doctor's going to order all this stuff.
Right.
Let's go ahead and get it going.
Right,
Because they're
right.
going to order it. Right?
Yeah, I think there's so much we can do with our license that,
100%.
people are afraid of
Protocols.
crossing. Yeah, exactly. That are afraid of crossing that line and whatnot. But yeah, no.
Okay, tell me, you said you like the mental health stuff. Tell me, you love crazy people. Tell
Oh,
me a
man.
crazy
Oh, crazy, like a crazy person.
crazy person.
Or like, because I mean, I feel like everyone that comes in is a crazy person. Let's see. I just remember one day, and I'm gonna be brutally honest because I want nurses to know, like, it's okay that you have these thoughts.
It's okay.
I just came into work one day and I was like, I just don't feel like smiling today. I'm just not in the mood. And so, this was back when I worked in California too. I was just like, I'm just not in the mood today. Like, bring me all the crazy people, because I loved it, because it was either B-52 and they were gonna sleep all night, or we restrained them and like more B-52 and they were gonna sleep all night, or they just wanted to be left alone. For the most part. I mean, yeah, you can talk about those patients that press the call light constantly and whatnot, but you didn't have to like fake a smile for them all the time. You didn't, you weren't worried about them complaining.
They're in a bad mood. I'm in a bad mood.
Yeah, you weren't.
Spirits, right?
Yeah, you weren't really worried about them complaining about you, because who's gonna really take them seriously, especially like the batshit crazy ones. Yeah, I just remember going up to triage to try to get a patient or whatever, and this lady just starts throwing herself on the ground and bashing her head on the floor, and I was just like, that one, I want that one. Let's go.
You're brave.
And so we take her to the back. Security all comes back because we know we're gonna have to restrain her, and she's just yelling at me like, "Fuck you, bitch! You just fucked my brother in the dildo with it in his ass!" Blah blah And I'm just like, okay, that's where we're at. Like, cool, this is fun.
Right?
You just laugh. Like,
Mhm.
I just find it hilarious. And some people are just like, oh, I don't have time for this today. I don't have time for this. And it's like, yeah, a lot of the times we do not have time for people. But kind of changing my thought process and how I deal with most all my patients when I go work in the ER, and it's not reasonable for everyone. I get it. It's your compassion fatigue, your empathy goes way down by day 3 or 4. It's hard. But I try to go in, understanding that everyone has probably some sort of story of why they're this off the walls or whatever it may be.
Yeah.
So I kind of look at them and just go, oh, okay, I'm
Did she hurt herself banging her head against the wall?
It was on the floor. She was
On
banging
the
her head
floor.
on the floor, but, I don't remember her. I don't think she did.
No CTs or anything like
No,
that?
no. Oh, wait, I have a way better, crazier one.
Yay! That was a good one.
I just remembered. Oh my gosh, okay. When I was, yeah, again, down in California, that's where all the crazy people are, I swear. I think I was just a nursing student, and I was, doing my preceptorship, and, this crazy guy just comes in kind of like, "Oh, he's just been doing meth all night or ecstasy or whatever it is," and he just coming in like bug-eyed, like, we're like, "This guy is weird." Anyways, so I was like, being a nursing student, I was like, "Oh, I'm gonna go find an IV or something to do." I can't remember what it was, and so then all of a sudden we hear like code gray, code what was it? Code silver.
Weapon.
Or yeah, and we were just like, "Oh my gosh." And then they were like code yellow and or actually I think it was code yellow. I can't
What's
remember.
code yellow?
Wait, it was code I don't remember what the hospital's ones. Code green was a crazy person going
Okay.
off the walls, right? And then it was like code yellow, I think was technically code silver. It was like there's a weapon. I was like, "Oh shit." So, but me, I'm so nosy. I'm like, well, what's going on? And so, there's all these police or security or whatever, and I see like a red dot on this guy, and he was in the bathroom. Well, he took the top
A
of a
red dot
clip.
like a laser beam?
I don't remember what it was because
Mhm.
I wasn't allowed to go in there, but I could see through the window, the doors separating to the next section. And he'd grab the top of the clipboard and stab himself in the neck 7 times. So they thought the clipboard was a gun.
Uh,
The top of the clipboard, it was a gun. So that's when someone called the, weapon. But
oh,
yeah, and he survived.
he did.
He survived, yes.
So
He
they
was
were
standing there like crazy. I remember seeing him standing there like crazy, just with, like blood everywhere. I had no idea what had happened initially, but
you can speak to this, but when somebody loses it and you look in their eyes, you can see it in their eyes. They are
yeah.
completely disconnected. It looks like
Yeah.
the demons in them.
Oh, yeah.
They're not a person
Yeah.
and they are not present.
Yeah.
And
Even the nurse was like, I knew something was gonna happen. She goes, he just like she was even saying stuff and like this guy does not look right.
wow.
Like he's about to do something or hurt himself. And luckily
Yeah.
it was himself and nobody else.
Yeah. Anything could be a weapon. You got to be careful.
Uh-huh.
You got to be. You
Oh
gotta be
yeah.
really
That's why they clear out all the rooms and
careful. Yeah.
whatever.
Do you have any foreign objects where they're not supposed to be story?
Yeah, I mean, there's the classic dildo, I guess, up the butt. A 13-year-old girl put a shampoo bottle up her hoo-ha.
Oof.
Uh-huh.
Ouchie.
Yeah, and it got stuck up there.
Ouchie. People are curious. People are curious.
Yeah, yeah.
Well, let's see how our IVs are doing. We still got.
Oh,
Are we still flowing?
I think
Oh,
we're
they're
no,
done.
we sucked it down.
Look at that. I'm gonna clamp mine off so I don't get blood flow.
Okay.
We'll do a little clampy clamp. How's yours doing back there, Nate?
He's good. He put his sky high, so he probably beat us.
Well, while we're talking about IVs, let's go to the IV business. Tell us a little
Okay.
bit about that. What does a nurse run IV business look like?
Well, you got all your IV stuff. You got to get your vitamins and, some medications for those occasionally sick people and stuff and whatnot. Chrissy and her daughter-in-law, Kira, have done an amazing job setting it up. Her daughter-in-law is great at running
Christy's your business partner?
Yeah. Well, it's her business. She's done a great job, trying to put herself out there and going to events and doing things. And her daughter-in-law's done a really great part at running the website and the business part because nurses don't know how to be business savvy.
It's hard.
We don't know how to ask people for money either. Like, we don't do that in our regular basis on a regular basis in the ER. So like the idea of tips is like, what? Like that's a thing?
Do people tip you in the IV business?
Oh yeah. Oh yeah. Some people, especially, I mean, because we do try to, people who are sick, we want to try to be available as much as possible for those last minute calls that people are sick. Some people book maybe like 1 to 2 days in advance, but a lot of the times is last minute
Mhm.
notice because probably about 80% of the calls we do are people that are throwing up, diarrhea,
Mm.
cold, flu, sick, just don't feel good, want to pick
So
me
you're
up.
doing more therapeutic IVs than you are like, "Hey, I'm a bodybuilder, I want peptides," or something like that,
Yes, yeah.
right?
We've pushed some of that. We've tried to gone to do some like health and fitness events and stuff like that. But I think a lot of people don't really think of it until like it comes to it. And so people who are very desperate are like those sick people that are Googling IV business. Where can I find one? Where do I want it now? And we like helping those people because of our ER experience and our background. It allows us to, give advice and input because every time you call a triage nurse, what do they tell you to do? Go to the ER.
Mhm. Yeah. You've
I
got a
don't
wealth of knowledge. I
Yeah.
I I tell nurses that want to get into become like a nurse practitioner, they're like, "Oh, what job should I get into?" I'm like, "ER." And
Yeah.
they're like, "Why?" I'm like, "You'll see everything.
Yeah. Yeah.
You'll work up everything,"
Yeah.
which is what you need to do as a provider. You need to have a little experience with everything. And if you do a
Uh-huh.
couple years of that while you're going to NP school, you're
Yeah.
good. You're good. I mean, you're gonna
Mhm.
see strep throat, you're gonna see
Mhm.
stuff up the hoo-hoo,
Minor stuff,
minor
sick
stuff, major
stuff.
stuff,
Yeah.
orthotomies. I mean, all sort chest tubes. I mean, broken bones, everything, and
Yeah.
you're gonna be part of that. And so I think it's a really. I kind of wish I would have had a little bit of that. My personality, I'm a little bit more chill. I don't know if that's a good thing or bad thing in the ER,
We need
um,
different personalities in the
but
ER.
I'm definitely not as much of a go getter as you.
Oh,
Uh,
thank you.
but it's a cool, interesting place. You got to be able to let go of stress, though.
Mhm.
If you internalize things, no, you
Mhm.
don't want to go there. The stress will
Mhm.
kill you.
And there's some people who are like that, and that's what caused them to leave the
Yeah.
ER, and that's fine. That works
Mhm.
for them. But yeah, that's what I've always liked about the job is that's why I couldn't really do management very well, because I love going to work and leaving,
Gotcha.
and not having to think about anything else and whatnot. But I do leave work, and then all I do is think about the IV business. So.
Gotcha. Well, you're doing mostly sick people. Like, what's a quote unquote cocktail that you'll do a lot of? Like, what kind of medications are you putting in IV bags?
We're doing vitamin C, magnesium, amino acids, or some sort of amino blend. We do have like Toradol and Zofran for those sick, achy people. Um, what else? Zinc is really good for those cold and flus.
Mhm.
Trying to think what else.
So magnesium to
Maybe
kind of
off
help
the
them
top of my
sleep and
head.
relax.
Yeah, yeah.
Vitamin C to give them a little,
Pick me up.
little pick me up.
Yeah, our B12 shots, the B complex, all the
You do
B
vitamin D.
vitamins. We do have vitamin D. That's in a shot though.
Yeah, but
Um,
just could do
but
a little.
yeah, we've actually done a few people with with vitamin D deficiencies and have
Everybody
had
has vitamin
issues.
D deficiency.
Uh-huh. And so in the winter time, like
So
we don't even worry about it. I'm just like, do you want vitamin D? I'm adding it to your B12 shot. Okay, done. Like it's just needed. And I mean, even Christy had a kid recently who the mom reached out and was like, the doctor refused to do a vitamin D blood test. And, or I can't remember the exact story, but anyways, his vitamin D was low, but the doctor said, oh no, it's fine. Oh no, it's fine. And so she's like, well, can I get a shot? And he goes, oh no, you should be fine. And this kid was like, 16 years old. He's pale. He looks pale. He's depressed. He doesn't go out with his friends. He just doesn't do anything. And then so Chrissy started doing some vitamin D shots on him, and he's like, back to himself.
vitamin D, a lot of people think of it as a vitamin. It's a hormone.
Okay.
It's not a vitamin. It's a hormone.
Yeah.
And if you're deficient in that hormone, there's all these biochemical processes that are involved in it. And by the way, the only way we can make it is through sunlight. And what do we do as a society? We are inside, in sheltered, avoid UV. When we do go outside, put on sunscreen, all that kind of stuff,
Mhm.
because we're terrified of skin cancer and all that stuff.
Right.
There was a story, and this is 15, 20 years ago that I heard, and I don't know if it's validity, but I heard, and I can't remember which Ivy League school it was, but there was a dermatologist in an Ivy League med school who was a proponent of vitamin D and sun exposure.
Hmm.
And he said just the vitamin D deficiency that leads to colon cancer kills, I don't know, 100,000 people a year,
Wow.
whereas melanoma kills 2,000 people a year. And he's like, we shouldn't be doing sunscreen. Like, get the vitamin D, prevent all these horrible, horrible things that can happen. And he was a proponent of that. They fired him. because it goes against the dermatology.
Right.
You know, these specialists get in their little bubble and all they think about is the skin.
Mhm.
Well, the skin's the biggest organ in our body and it's important. You
Mhm.
know, it breaks down all sorts of stuff, you
Mhm.
know, and makes vitamin D.
Mhm.
And so if you, for a hot minute in my practice, I tested everybody in vitamin D. With
Mhm.
rare exception, they were all deficient. And
Mhm.
there's different levels of deficiency. There's deficiency in
Mhm.
or insufficiency, deficiency, and then like really bad, right?
Mhm.
Uh, and the other thing is what is normal? Normal is a bell curve, okay? And normal 100 years ago was probably shifted up. But
Mhm.
as time goes by and we get less and less vitamin D, that bell curve will shift down. And so what is normal now is not what was normal 100 years ago,
Mhm.
because the population had more vitamin D 100 years ago. So that bell curve has shifted down.
Hmm.
Get vitamin D. If you don't,
Oh, yeah.
it's easy, it's cheap.
Yeah.
Vitamin D3,
Yeah.
5,000
What do you think of,
milligrams.
like, the genetic testing, like biohacking and stuff?
Oh yeah, I don't know a whole lot about it. I do know about the MTHFMR
Yeah.
gene. That's the folic acid gene, and we put folic acid on everything in
Right.
this country.
Yeah.
I don't know if you're familiar with that or not.
Yeah, yeah, yeah. Because I did the testing and it said that I was prone to vitamin D deficiency.
There you
And
go.
so I was like, well, that makes sense. Maybe that's why I have seasonal affective
100%.
disorder or whatever.
100%. So do you do vitamin D routinely? Do you
Oh,
take it?
yeah. Uh-huh. Yep.
Yeah.
Yep. I do.
I do 5,000 milligrams or 5,000 international units every day.
Yeah.
I pop it. And what I do is the supplement I take is coated in fat because vitamin
Mhm.
D is a fat soluble.
Mhm.
So I'll always make sure I eat it with a little bit of fat.
Yeah, same. Well, that makes sense now that you say that about it being a hormone because I mean, along with B complex and magnesium, it's very common deficiencies in women in regulating their hormones and stuff. And me being a mom, just having a baby, yeah, my hormones are all over the place. My emotions are
100%.
all over the place. But like if I take my vitamins, I'm like, oh, I feel a world of a
I
difference.
feel a world of difference right now.
Yeah.
I got a little vitamin C, a little mag. What other stuff do we have in the cocktail today?
What else did I put? I can't even think right now. I put a little bit of taurine, hopefully for a little bit of energy,
Yeah.
and then just the B vitamins, the mag, and the vitamin C, the
Yeah,
B
perfect.
complex. Yeah.
We'll do for those of you who aren't watching, we'll do a little video clip of us out in the lobby getting starting IVs on each other. It was a lot of fun. I literally the first time in my life where I had an IV and I was
Giving
inserting an
it.
IV. First time ever for me. So getting a little fluid and giving a little fluid. So
Yeah.
that was a lot of fun. So you probably find that line of work pretty rewarding because you're dealing with probably cancer patients and sick patients, right?
Yeah, there's a couple people out there that want high dose vitamin C and glutathione. We can't give too high of a dose without other testing, I guess. Um, but for the most part, people are very friendly. I don't think I ever walk away annoyed or frustrated or anything like that. I do get annoyed sometimes when it's like 7 o'clock at night and somebody wants an IV and I'm like, oh, I always end up getting there and they're sick and I make them feel better. I'm like, okay, that was so worth it.
Yeah. Made a little
That
money
was
in this.
worth it. Yeah, but just making people feel better, especially and help them sleep and stuff. It's like you don't get that satisfaction in the ER a whole lot. They're kind of mad when you're discharging them for some reason. I don't know why.
Well, I'll tell you my recent ER story, and this is a true story. And I was a little irritated.
Yeah.
I had chest pain
Uh-huh.
in my left chest, and it
Uh-huh.
was kind of nagging. It started like on a Thursday, and it was kind of deep. And I'm like, what is that? I'm like, I probably pulled a muscle.
Yeah.
And then the next day it was a little worse. And I'm like, okay, it's pretty constant. I don't think this is heart. And then the next day I was like, oh my gosh, this is really, really bad. And then that night I couldn't go to sleep, and I was just excruciating pain. I'm like, I got a DVT or something going on
Uh-huh.
here, or a PE, pulmonary embolism or something.
Yeah.
So I ended up to go to the ER, and they do the CT angiogram and all that workup, looking for a clot, and
Uh-huh.
they have no idea what's going on, and I'm writhing in pain. I mean, I would have chopped my leg off to get rid of the pain. I'm like, what is going on? ER physician didn't have any idea what was going on. Gave me a bunch of morphine. They're like, how do you feel? I'm like, oh, a lot better with that morphine. Okay, we'll see ya. And I'm like, well, this is going to last a hot minute. What happens when this morphine wears off, right?
Uh-huh.
But they didn't know what was wrong with me.
Uh-huh.
Sent me home. I've been writhing in pain, about ready to go around. I'm like, okay, and by the way, I had clinic the next day. I had all these patients to see.
Yeah.
And I'm like, I'll just go see the first couple patients and I'll cancel my schedule for the rest of the day.
Yeah.
I wake up, get in the shower, I look, herpetic rash.
Oh.
Shingles.
Oh my
Got
gosh.
shingles. And I'm like, oh
Ow.
my gosh. I took a picture, sent it to a provider friend of mine. I'm like, "Is this shingles?" She's like, "Yeah,
Oh my
yeah,
gosh, I heard that's so painful.
worst pain I've ever had in my life."
Yeah, yeah.
But I was frustrated
Well, you feel
because
validated, like something
ah,
was wrong, I'm not
right,
crazy.
right. Well, and I'm the emergency room physician. Like, okay, they got bigger fish to fry than somebody
Yeah.
that's in pain,
Right,
right?
right,
But it's a little frustrating.
right.
But at 2 in the morning, where else are you
Yeah,
gonna go?
yeah. Well, it's taken a whole different view too, and this is gonna sound super like nursing schoolish, but it helps me get a better. I've gotten a better understanding of what holistic nursing truly meant.
Mm,
Like, and I really think it's empathy. Like, it's understanding someone's whole world and like what works for them, right, and what's not. Like, if someone understands, hey, you are, a doctor with this pain, like this is like there's something going on. Like, if someone understood you and your background and that this isn't normal for you, like maybe they would dig a little deeper and ask a little bit more questions instead of just going, all right, chest pain, EKG, troponins negative, you're good to go.
yep. CT
Done,
angiogram.
right?
Yep.
Like, yeah.
Yeah, they did the work if they went go.
Yeah.
You probably get a lot when you're doing IVs. You probably get a lot of good stories. Like, do you have any have you met any really interesting people with really interesting stories? Because you're sitting there with them for 30 minutes to an hour, right?
Yeah, yeah. Oh man, I don't know if I have any really interesting stories. Chrissy and I went one time and we did an IV for a group of people that were here shooting content from like Utah or whatever, shooting content for some guns or something,
Oh,
and they
okay.
were just like all wanted IVs and stuff.
Was that last weekend?
No, no, no. This was a while
Okay.
ago.
I was at an event that I got invited to set up a health booth at a gun range. They were doing a gun event,
Oh,
and they also needed a provider in case somebody had an accident. So I set up a
yeah,
health booth, and
yeah,
I was wishing I had an IV because it's like 94 degrees outside, and I've been outside all day, and
yeah,
I was like, oh, bag
yeah.
of LR sounds really good right
Yeah,
now, right?
yeah. Sometimes we get called out to like the hotels around here, and so like I'm just waiting for the day where maybe it's like someone who's visiting in town who's famous or something, when we get called to the the fancy hotels, but next to the arena or whatever, the
What about
stadium.
like drunk people? Do you get a lot of like
Really, we don't.
really? That's
Maybe
surprising.
like a couple times a month we get some people, but not a whole lot of drunk people. But I do recommend doing it before you drink for sure.
The bag of LR before you
Mhm,
before you
yeah,
drink.
yeah, if you do it before, it's like drinking on an empty stomach, right?
Mm.
If you do it before, it's gonna help you last longer and process everything better. That's what I've noticed when I've done it. I've done it before
Let's
drinking.
go out to town and pick a bag, right?
But then once you've been drinking all night and then you sleep and you wake up and you feel like shit and you try to get the IV, well, the IV makes you comfortable enough that you could sleep, not, ready to go because you hadn't slept all night. You just drank. Like you don't get good sleep with that. So, yeah.
For the person listening, like, what's an average, like, hey, I'm going to come to your home and hang an IV going to cost them?
No, it depends what they want. Just
Sure.
basic fluids can range around $150.
Okay.
Once you add vitamins and stuff, you can go all the way up to 250, 300, depending on what you want. Yeah.
Okay. So, yeah, there's a little bit of cost associated with that. But I
Yeah.
mean, think about it. Like, you're in your house, somebody shows up, hangs a bag.
I know. I feel bad sometimes because to me, it's like I feel like I can get IV fluids easily, no big deal.
Well, think about what they need, though.
But
Like,
what they,
what you're doing.
yeah,
Otherwise, they'd have to go to urgent care or
yeah,
ER,
yeah,
talk to a doctor, $200
yeah,
just to talk to him.
yeah.
And then the doctor's going to charge him $150 to hang the IV bag. And they just wasted half their day.
Oh, but you forgot about all the labs in the CT angiogram.
That's a whole other thing, right? I haven't even got
Yeah.
that just happened to me the other day. I haven't even got the
Aw.
bills yet. I'm like dreading the bills because it's all going to go to the deductible, right?
Yeah, yeah,
So, but
yeah.
yeah, so one of the things I've noticed with nurses is they tend to undervalue themselves.
Mhm,
And you hinted at that a little bit, like, oh, I feel
mhm.
bad charging this money. You got to
Yeah.
think, man, I'm so glad I'm so glad I'm in a business where people value me enough to pay me this much.
Right,
Because the
right,
hospital's not paying you that
right.
much. Like when
Well,
you
some people don't even see me as a nurse. Some people don't even know that I'm a nurse.
at the hospital.
Oh, no, when I go to their houses and
Oh,
I'm like, "You
really?
just let somebody in and you don't even know what I do or what I'm about to give you." Like, some people just don't care. But the same thing, and that's how all of medicine has been set up, is because doctors don't care because patients don't care. They don't care how much meds they're on or what they're taking or whatever, and so there's some people who are just like, "Oh, yeah, whatever." Yeah, some people don't even know that I'm a nurse. I've offered my advice, and it didn't go very well.
Mhm.
And so, yeah.
Do you have clients that like it's like every Monday at 2, you're hanging an IV bag?
There's a couple. We have a couple out there. We got one gal who's got a bunch of kiddos and gets sick all the time, and when she's home alone with the kids, she wants To feel better.
Mm.
And I can totally relate with that. You wanna be fixed the next day. You don't wanna be home alone taking care of sick kiddos, being sick yourself.
Kids get sick so often.
Yeah,
It drives me
yeah.
nuts.
We get
Do you do pediatric IV
no,
bags?
no, no,
Just adults?
no,
What about
no.
like a 16-year-old?
We'll do that. Oh, yeah, yeah, we'll do that, but I don't think we do I can't remember, is it 12 or 14? Chrissy wanted to do I can't
Yeah,
remember.
it's probably better safe than sorry. It can really fluid overload somebody if you're not being careful.
Yeah, yeah.
Um, okay, well that's cool. Well, that's interesting. You've really kind of have your foot in a lot of different.
Yeah, it's fun. It keeps it exciting. It keeps you, keep doing different things and
That's what's
keep you
great about nursing,
entertained.
right?
Oh, yeah, exactly. Notice I probably about every 2 years I get bored and do something different is about my my schedule.
Yeah, if you look at the studies, a new grad nurse will only stay in their first job for I think it's 2.5 years, something like that,
Uh-huh.
and then they're moving on to something else. And
Yeah.
in my experience, and probably yours too, nurses stay probably 2 3 years and move on,
Mhm.
and get into management and things of that nature, and go back to the bedside or
Yeah.
get in a transfer center or something.
Yeah.
There's just so many opportunities in nursing.
Yeah.
So many opportunities in nursing. Uh, People don't realize when you go to the hospital, you're not going to the hospital for doctor care. You're going to the hospital for nursing care,
Uh-huh.
right?
Uh-huh.
Nurses run the hospital,
Oh, yeah.
and so
That's how I didn't really pick my OB, but picked my OB. People were like, "Oh, who's your OB? Who's your OB?" And I'm like, "I don't really care who my OB is." I was like, "'Cause my nurse is gonna be the one mostly like dealing with it and, delivering the babies." And luckily my labor and delivery nurse was a trauma nurse, like used to be a flight paramedic and like all this stuff. And I was like, "Perfect, you're the guy that I want in the room if anything bad happens." Like that's all I cared about. Even though I love my OB, she's super,
sure,
super sweet.
sure,
I just didn't really care that much because I was like, well, I know the nurses run the show anyways, and they're going to be one telling the OB what to do. So
yeah. The OBs just come in and catch the baby, right?
yeah, for the
Obviously,
most part.
obviously, there's more to
They're
it than
making other
that.
decisions, but no, my nurse did a really awesome job at being like, "Hey, maybe we should push for this, and maybe we should do this, and maybe we should do this." Your first one you labor forever, before going to a C-section or whatever. And
Did you get a
so,
C-section?
no, no,
Oh,
no,
good. Thank
no, it was like
goodness.
a 40-hour labor though.
I think it's like 28% of pregnancies now end in C-sections.
Oh yeah,
Something like that. Yeah, it's
yeah,
pretty high. It's pretty high. But if you think about it, like 200 years ago, what killed men? War. What
yeah,
killed women? Childbirth,
yeah,
right? And now, I mean, war can still kill men, but
yeah,
not so much as much, like
yeah,
as a percentage of the population. And
yeah.
childbirth,
And we can detect more stuff early on so that you can, plan to just do the C-section beforehand and whatnot.
pregnancy is now what's the word? Celebrated,
Uh-huh.
whereas before it was like, this is going to kill me.
Yeah.
Right? And can you imagine living with that? Going, oh my gosh, I'm pregnant. I might die.
Yeah. No, I think about that, like, in, like, what, the Victorian era
Oh,
or the
100%.
medieval times. I'm like, "Oh my gosh, I would never be able to do that." Well,
Mm-mm.
how was I pregnant at the time when I watched, like, The House of Dragons? Have you seen that? In the first
Go for it.
episode, and they cut the lady open and she dies, and I was like, "Oh,
Yeah.
I'm so glad I'm not in that time."
That's a pretty dramatic scene.
Yeah.
It's June, and I think this weekend or the next weekend the new season comes out,
Uh-huh.
and so my wife and I rewatched it. We just literally watched that episode
Oh,
not too long
really?
ago.
Yeah.
Like, oh, this is
It's intense to think about that when you're pregnant and you're like, "Oh my gosh, I would have never made it through, these times," or "How did women labor for this long?" Like, it's exhausting. Yeah, it's a lot of work,
a
so
lot of work. So,
yeah, but you're proud of yourself too once it's over.
of
You're like,
course, you
"Holy
should
crap,
be.
I just did that? Hell yeah."
Well, you'll be
So
really proud when they're 18 and they're getting out of the house. You're like, I made that. Everybody's did it. That's where I'm at right now. My oldest
Aw.
son's going off to college this fall, so it'll be fun.
Oh, yeah, I celebrate, like, my daughter's potty training right now. I
Oh,
mean,
that's
like,
great.
poo-poo in the potty is so exciting.
I know.
I'm like, "You're so smart."
Yeah. Now it's like get out of my house and go live
Yeah.
a life, right?
Yeah.
Okay. Any last minute thoughts? We've got a lot. We went through a lot of fun stuff.
Yeah.
You've got quite the experience in the nursing field.
Thank you, thank you.
Yeah.
I mean, I'm really big on mental health for people and figuring out themselves. And it's like, what is burnout and stuff and how people manage that. And one thing I think a lot of people forget is doing your own self work. Like,
Mhm.
you can exercise, you can eat right, you can do all these things. They say, "Oh, do all these things," but what work are you doing on yourself? So,
Mhm.
like, are you listening to podcasts? Are you reading books? Are you going to a therapist? Or whatever it may be. Instead of just taking whatever antidepressant you know, or whatever, benzo you got out there or relieve your anxiety. I mean, so my choice is wine, but but what other things
Biochemically
can we
very
do to
similar.
still to work on us to maintain that empathy, because we've all dealt with our own traumas,
Mm.
and we need to learn on how we process those traumas and how we move on, and like what are our coping mechanisms besides just working out and all this stuff, and looking at ourselves and figuring that out and how we deal with the day-to-day traumas.
Yeah, that's good advice. I think that's a good place to stop.
Yeah.
So cool. Well, thanks so much for coming on the podcast, and thanks to all of you listening to us. Do you want to give a plug out for your business? You're in the Boise, Idaho area.
Uh-huh.
Give a little plug out to the business. How can, if they want an IV to your house, how can they get a hold of you?
Oh, they can call us, they can look us up, or
What's your business name?
Revive Wellness and Recovery, not Restore. Everyone gets that super confused. So Revive.
Is there a business out there called Restore?
Yes, it's
Oh,
all over the place, and it's so hard because they are
similar.
so franchised and whatnot. But it's just me, Christy, and we got one other gal working with us. You get a very personalized experience with us. Very experienced nurses. We know what we're doing, and we're always willing to work around people's schedules. So even if you don't see availability, we're always willing to see if there's one of us is out there or available. And we like to try to make it work, especially if you're sick, and make you feel
Do you have a
better.
website?
Yeah, revivewellnessandrecovery.com.
Perfect. Well, thanks again for showing up, and thanks for doing this awesome podcast. You've been great.
Thank you. Thanks
It's
for
always,
having me.
yeah, it's always fun to hear someone else's story. So that's it. Thanks for following with us, and we'll see you next time.